Finally tonight, a report on the power of music therapy in treating brain injuries and helping patients recover. It's a field of science and medicine which has captured new attention because of its role in helping Congresswoman Gabrielle Giffords recover from her serious brain injury. NewsHour correspondent Spencer Michaels reports.
When Representative Gabrielle Giffords returned to Washington for this year's State of the Union address, it was clear she had made a dramatic recovery after being shot in the head a year ago. Her family credits music therapy for helping to get her voice back.
And liberty and justice for all.
Giffords' treatment with specially trained music therapists has called new attention to a field that's been around at least 100 years. While research on the neurological effects of music therapy is in its infancy, what is known is that a number of regions in the brain are activated by listening to music. And scientists say the brain responds to music by creating new pathways around damaged areas.
Just give it a tap. There it is.
Let me change it.
You change it?
Yeah.
You think the guitar is all right?
Music is now being used to help patients with a wide variety of illnesses, not just brain trauma. That's the case with 16-year-old Michael Hendricks Jr. of Pinole, California, who has muscular dystrophy, a disease that progressively weakens the muscles. Megan Hughes, a music therapist, has been working with him at the Benioff Children's Hospital at the University of California, San Francisco.
Due to his condition, there's a lot that he doesn't have control over. And so we use music as a means to help him get in touch with that control.
Do you see it working?
I think that hopefully we all saw it working today. I think that was evidenced through Michael's smiles, through his focus on the music making process.
Go get some food, then I'm going home, because I'm tired, being at the hospital,
Hendricks' father also believes music, in his case rap or hip-hop, is one of the few ways to reach his son.
He's got a new pair of headphones to listen to his favorite music, which is Lil Wayne and Drake. Okay, he definitely has music in his brain all the time. He loves the beats.
So can you tell if music helps in his situation, with his mood or with anything?
Yeah, it helps in his attitude. He kind of mellows out, and he doesn't think about his medical problems.
What did I just do with my hand when we were playing?
You were going up and down to make this noise sound louder?
Hughes works for the Center for Music National Service. The program sends therapists into hospitals and schools to expand the use of music.
I'm surprised to hear him sing on that.
had a lot of people try to steal you.
The program is the brainchild of musician Kiff Gallagher, who worked on AmeriCorps in the Clinton administration.
It's definitely been shown that music can make a positive impact on people suffering from early onset dementia, kids with autism, with veterans who are coming back and trying to learn to walk without a limb.
Music therapy professor Eric Walden, who teaches at the University of the Pacific in Stockton, California, says he's seen and studied patients with brain injuries where music makes a difference, as it apparently did in former Representative Giffords' case.
It's the rhythmic aspects of music that are providing that structure or that organization within time that are allowing her to learn to walk again or to gain speech sounds. I think what we find in people that have had brain injury, sometimes it's easier for them to sing words rather than to say words. Music is providing that pathway, or almost like a cerebral bypass around the damaged areas, allowing someone to regain mobility or regain speech.
A growing number of studies do suggest music can aid healing in various ways. One recent scientific paper out of Harvard showed music therapy helped stroke patients regain speech. And other studies found music may improve heart and respiratory rates and blood pressure, as well as anxiety and pain in cancer and leukemia patients.
Gonna listen.
What to do with that?
Where does it go? Where does it go?
Dr. Rob Goldsby, a pediatric oncologist at Benioff Children's Hospital, has seen that happen.
Music therapy, quite literally, can soothe the soul. I think helps them get through the process of cancer therapy. They have to endure the pokes and prods of exams and the multitude of tests that they have to go through, the vile chemotherapy they have to endure, the vicious radiation and surgery.
But scientifically studying, quantifying, and proving the effects of music therapy on patients with different ailments and different treatments presents a big challenge, says Julene Johnson, a PhD in cognitive neuroscience at the University of California.
One of the challenges in doing clinical research is actually getting a homogeneous enough group to really look at the effect of an intervention on a group of patients. I think we're still really trying to understand the mechanisms that influence the therapeutic effects of music.
Johnson has been studying how music appears to lower depression rates among senior members of choirs in Finland. She says music can actually change the brain.
There now are several studies showing that participating in music has an impact on the structure of the brain.
And involvement in music can benefit anyone, says Heidi Claire Lambert, a fiddle player who teaches folk dancing to health professionals as a means of healing.
One of the things in healing is the frame of mind, correct? You've got to get the will of the person. It's not about the technique. It's about enjoying, about moving, about just being in the moment.
And is this, in your opinion, a kind of a form of therapy?
Absolutely. I believe unequivocally.
But dancing or singing is not strictly music therapy, argues Eric Walden at the University of the Pacific.
It isn't Johnny went to choir and Johnny got better. It's that Johnny has a music therapist, and together with the music therapist, he got better.
But Johnny taking part in a chorus actually could be therapeutic, couldn't it?
Absolutely it could, but it's not music therapy. The term therapy itself says that there's a therapeutic relationship, and there's an intentional use of music to address non-musical goals.
The University of the Pacific has one of 73 music therapy programs in the country. Students in the four-year program are already musicians when they arrive on campus.
You say stop, and I say go, go, go.
At a Stockton school for medically fragile, severely disabled children, music therapy students are trying to engage those with special needs. Even with this hard-to-reach group, Professor Walden argues, the therapy has an effect.
Music can provide a mechanism for children with developmental disabilities to communicate. What we know about the brain science in general is that whenever you experience something new brain connections are being made. What you're doing is you're providing an opportunity for them to grow new pathways within their brain.
Oh, will you high five to say hello? Hi, Lexi. Can you high five to say hello? Nice smiling. Up high. Yeah, nice high five. Woo.
The fact that music often can encourage and stimulate patients who are hard to reach has spurred scientists to delve deeper into how it affects the brain and how that knowledge can be used to improve the therapy it provides.
We're glad you're here. We're gonna have some